How do you know if you're overtraining? Let's break it down. The goal of any form of training is to provide progressive overload to the muscles in order for them to adapt. Progressive overload is when we gradually push our limits so that we become better and better. However, this can have diminishing returns if we push too far and cause overtraining. Good training programs seek to avoid combining excessive overload with improper recovery,
aka too much too soon.
Overtraining is a continuum and can be broken down into 4 stages. The first phase is acute fatigue. This typically lasts a couple days and does not hinder performance. It can be described as excessive fatigue. The second phase is functional overreaching. This phase typically lasts a couple days to weeks and causes a temporary decrease in performance before returning to baseline or slightly above baseline. The third stage is non-functional overreaching, and this is where things start to go downhill. It can cause a decrease in performance, altered muscle contractions, a decreased immune system, and hormonal imbalances, just to name a few. The fourth and final stage is overtraining syndrome. This stage will last weeks to years. It has all the same symptoms that non-functional overreaching does, but more severe. It also causes sleep disturbances, which can make it very difficult to recover properly. Both aerobic and anaerobic athletes can experience overtraining syndrome. There are 2 main types of overtraining syndrome: sympathetic overtraining syndrome and parasympathetic overtraining syndrome. Sympathetic overtraining syndrome is characterized as an increased amount of sympathetic nervous system activity at rest. But don't let the name fool you. The sympathetic nervous system is anything but sympathetic. It is commonly referred to as the fight or flight system. The sympathetic nervous system increases heart rate and blood pressure, as well as sends blood to the muscles so they're ready to move. Parasympathetic overtraining syndrome can be characterized by an increased amount of parasympathetic nervous system activity both at training and during rest. The parasympathetic nervous system is commonly referred to as the rest and digest system. It essentially has the opposite reaction to what the sympathetic nervous system does. The parasympathetic nervous system decreases heart rate, decreases blood pressure, and sends blood back to the organs such as the stomach and the liver. Anaerobic overtraining often occurs when the volume or intensity of training exceeds the athlete's ability to recover. This can present itself in many different ways. There's a few things we want to check for. First, is the athlete experiencing any decreases in performance, constant fatigue, an increased rate of perceived exertion, or any trouble sleeping? Second, is the athlete performing poorly on any routine exercise tests, or do they have any vitals, such as heart rate, that are out of the ordinary? Third, is the athlete increasing in volume or intensity too quickly? Or do they have a lot of competitions that are all back-to-back? Fourth, what are the other confounding factors that could be affecting their stress levels? We should try our best to take into account all forms of stress, both physical and psychological, that the athletes may be experiencing. This includes things such as school and relationship issues. Fifth, do they have any physical confounding factors, such as illnesses, autoimmune diseases, or any other issues that could cause a limited amount of recovery? Another factor athletes may experience is mood disturbances. Athletes may experience a decreased amount of confidence, vigor, and motivation, while experiencing an increased amount of anxiety, depression, and irritability. Another area that could signal the development of overtraining syndrome is hormonal imbalances. Although admittedly, this is hard for most people to do because it requires regular hormonal testing. Aerobic overtraining occurs when an athlete's training exceeds their ability to recover. Interestingly, aerobic overtraining can cause the resting heart rate to either increase or decrease, which makes resting heart rate hard to use as a diagnostic tool. On the other hand, heart rate variability can be a good diagnostic tool for overtraining syndrome. Heart rate variability will decrease when there's an increased amount of sympathetic nervous system activity, which, if you remember from earlier, is anything but sympathetic. One important factor that plays into the occurrence of overtraining syndrome in aerobic athletes could be a caloric deficit. Because aerobic athletes burn so many more calories than their anaerobic counterparts, a lot of times they're in a constant caloric deficit. This prolonged caloric deficit may cause a decreased amount of muscle glycogen as well as an increased amount of creatine kinase in the blood. Aerobic overtraining is also affected by several hormonal factors, one of which is a decreased amount of free testosterone, which will negatively impact the testosterone to cortisol ratio. Another effect is that the pituitary gland can start to release less growth hormone. Perhaps the most important to measure, though, are the levels of catecholamines. Catecholamines include epinephrine, norepinephrine, and dopamine. Overtraining can cause chronically elevated levels of epinephrine and norepinephrine, while causing chronically decreased levels of dopamine. Some markers to watch out for with aerobic overtraining are decreased performance, decreased VO2 max, decreased body fat percentage, increased muscle soreness, mood disturbances, alterations to resting heart rate, or hormonal imbalances, just to name a few. Preventing overtraining is not hard, but it does require conscious effort. First, we want to create a calendar of all the important events or competitions, so that way we can create a program that fits around all of those dates to allow the athletes to be prepared for each one. Next, remember the 10% rule. This rule states that we should never increase the weekly volume more than 10% from week to week. Another factor that we want to consider when creating our programs is added stressors. This includes things such as work or school, but also includes things such as the weather. For example, if we know final exams are coming up, we may want to decrease in practice a little bit because the athletes will already be stressed. Finally, we want to make sure the athletes are sleeping well and eating enough. You'd be surprised how many athletes are in a constant caloric deficit because it's hard to eat enough calories to keep up with how much they're burning, especially if they're eating the healthy food that they should be. Detraining is the opposite of overtraining. It is a loss of training adaptations due to an extended amount of insufficient training stimulus. Basically, when you stop training for an extended amount of time, the training adaptations that you gained will gradually begin to revert back to how they were prior to training. Unfortunately, training adaptations to aerobic training are typically the most sensitive to detraining. Athletes will begin to see a significant decrease in performance in about 4 weeks of detraining. Similar to the aerobic detraining timeframe, strength adaptations will similarly begin to decrease in about 4 weeks of detraining. Although it's rare that strength gains will decrease all the way back down to baseline. Most of the time, some of the strength gains are retained. However, sport-specific movements and power movements may begin to decrease faster. It is important to make a clear distinction between detraining and tapering. Tapering is an intentional decrease in training volume, but not intensity, in order to prepare an athlete for competition. The goal of tapering is to reduce residual fatigue and allow the athlete to perform at their maximum ability. All in all, our training should be like Goldilocks. Not too little stimulus that we're detraining, but not too much stimulus that we're overtraining. Somewhere in the middle where we're progressing our goals and achieving what we want to achieve. So how can you prevent overtraining? By far the best thing you can do to prevent overtraining is sleep better. This means getting 8 hours of quality sleep each night. Matt Fraser has this one quote that says, "If sleep was not a normal thing that we all did, it would be a banned substance." It's important that we not only focus on the length of time we're asleep, but also the quality of our sleep. In order to get high quality sleep, we want our room to be completely dark, completely silent, and a cool temperature. The second best thing you can do to prevent overtraining is eat right. This means both eating healthy, nutritious food, but also eating an appropriate amount of calories. I recommend trying to get some protein and carbs, along with some water and electrolytes after a workout, to help refuel and rebuild your muscles. Other great recovery techniques include stretching, foam rolling, and light cardio, such as walking. But remember, it's extremely important to focus on nutrition and sleep to prevent overtraining.